On 10 March, doctors and other healthcare workers from Chris Hani Baragwanath Hospital in Soweto took part in a protest to highlight the desperate conditions under which patients must receive medical treatment inside Africa's biggest public hospital. But even for Soweto-based author and media personality Musa Mbewe, who has been advocating for years for better public healthcare, reports of great shortages at Baragwanath Hospital came as a shock.
I didn't hear the same thing happening in prisons. Why were people in hospital not having food? How on earth does that happen? That was, for me, that was the wickedness of the highest level ever. Shocked is an understatement. I could not even believe it.
This former banker and radio presenter has used her public platforms to call out medical malpractice cases, specifically at Soweto public healthcare clinics and Chris Hani Baragwanath Hospital.
The number of mistakes and negligence that is happening in the hospitals shows you that there is no one who really cares. Some of the things are things that can be avoided. There's no accountability. There is no monitoring. So people do whatever they please, whatever that they want, and they know they get away with it.
Musa, who is also a church leader in her Soweto community, says in all the cases over the past 3 years where she's represented patients, nobody at the public healthcare facilities has been held accountable.
So how many lives of people who dies prematurely because we've got the health system that has got people who don't belong there? We need to stop thinking that when we are saying people must be dismissed, we are being harsh. It's not harsh. These are people's lives. This is a place where we cannot take two chances because they can be one of the million patients that we've got, but they're everything to other people. At least care about those things.
In recent cases where Musa represented patients who claimed to have been maltreated at Chris Hani Baragwanath Hospital, she says it was the nursing staff who neglected to carry out their most basic duties like changing wet or soiled linen.
People are not called now to be health workers. They're not. They just are. They don't have work. There's an issue of unemployment. A person doesn't care. Every time I had to get the service, I must fight. And if you cannot fight, you're not going to get it. But how many people are bold to do it? We are not designed the same. Not everyone is conversant. Not everyone can stand and say, I don't care if I'm going to be shamed or insulted. I'm going to take it. Not everyone is built like me. So how many people will go back without getting what they are supposed to be getting?
In a recent case, a pregnant woman who was treated at Baragwanath Hospital's maternity ward told Musa that there was no running water and conditions were dirty. In earlier cases, pregnant women were expected to sleep on the floor. Musa says the public should be alarmed by the fact that political leaders make use of the private healthcare sector, or in some cases fly overseas for medical treatment.
Why don't they trust their system enough for them to actually bring their own children here, bring their own families here, so that that thing can actually change? Because when it's them, even if they get injured here, they will just be attended for a few minutes, but they will be flown to another place, which is the private sector, which tells you there is something wrong with our system.
Musa says there must be a call to action amongst members of the public to force the Gauteng Health Department to overhaul the public healthcare system.
Where do we go until we take it upon ourselves to say, these people need to know that we are here and we know that they have to save us and we must treat them how they should do it. And if they don't do it, there must be somebody that is there ready to fire them. Let's take those videos. Let's take them when they do these things. Let's take those pictures, but not only take it just to put it on the public media. Something must give. Something has to give. It's too much lives.